Taking care of patients with brain tumors is one of my passions in neurosurgery. Tumors can occur almost anywhere inside the skull. Some need treatment and some don't. And whether we decide to treat them with surgery depends on things like the size, location, how quickly they're growing, and whether they're causing symptoms. Some brain tumors, particularly those that are small or benign, may not need any surgical treatment at all. But those that are larger, growing quickly, or causing symptoms often do need surgery, and I offer a variety of surgical tools, including removal by a technique called craniotomy, stereotactic radiosurgery or gamma knife, and finally a newer and minimally invasive technique called laser interstitial thermal therapy or laser ablation. One of the surgical treatment options for a brain tumor is called a craniotomy. Historically, this has been the most common surgery that we've done. A craniotomy involves creating a window in the skull through which we can access and remove a tumor. We use a variety of high-tech tools nowadays to do this as safely and as minimally invasively as possible. Those include creating a 3D GPS map of the brain so we know where the tumor is and how to avoid tissue that's around it that we don't want to disturb, and also a technique in which I have extensive training called brain mapping. I use brain mapping to map not only where the movement fibers are in the brain, but where the speech fibers are so that we don't interrupt critical functions like movement and speech. This is a technique that we sometimes use for tumors in the brain depending on where they're located. What we're trying to do with brain mapping is determine where the normal functions of the brain are that we want to avoid disrupting in a tumor removal, things like movement or speech or vision. For motor mapping, for example, I'll stimulate the brain to look at where the movement fibers are so that we don't interrupt them as we're removing a lesion or a tumor. Speech mapping is a different technique that we actually perform with the patient awake and talking to us. This is not a painful procedure because the brain itself doesn't have any pain fibers, but allows me to understand where exactly in the brain the speech region is so that we can go around it when we're trying to access the tumor. At the end of a craniotomy, we replace the piece of bone that we removed using tiny titanium plates and screws. These are about 1 millimeter thin and they sit under the skin so they're not visible from the outside. And fortunately, they do not need to be removed in the future. Radiosurgery or gamma knife is an alternative to a craniotomy for treating brain tumors. This is an outpatient procedure and is less invasive than a craniotomy in that it doesn't involve any anesthesia or incision. Radiosurgery is a great option when there's more than one tumor in the brain or when a tumor is located in a very sensitive or difficult to reach area. Gamma knife radiosurgery is performed as an outpatient, meaning you go home the same day. On the morning of the procedure, you arrive and I attach a metal frame to your head. We obtain a CT scan, and then we deliver focused beams of radiation to the area where the tumor is. This is a painless procedure, and it lasts no more than an hour or two. At the end of the radiation therapy, we remove the frame and you're able to go home that same day. Laser ablation or laser interstitial thermal therapy is a third surgical option for treating brain tumors. In this procedure, we introduce a very thin catheter with a laser light into the brain in the area of the tumor, and we burn the tumor using an MRI to guide us. The MRI gives us real-time information about temperature changes in the tissue, so we understand when we have irreversibly damaged the brain tumor. Laser ablation is less invasive than a craniotomy, and it's a great option for some patients that have deep lesions that are hard to access with an open surgery. Endoscopic surgery is another option for removing some brain tumors, particularly those that are in or near the pituitary gland. In an endoscopic procedure, we introduce a thin camera, often through the nose, up towards the area where the tumor is located, and we use long instruments to remove the tumor in a relatively minimally invasive way.